what we're seeing in Maine is a reflection of the national trends as well.
Dr. Pateri Vaz, Maine CDC director. According to CDC data, as of December 26, Maine had 93 individuals hospitalized for COVID infections, most of whom were 60 or older or at high risk.
And unfortunately, we had 5 individuals in Maine who died in the last week.
Dr. Voss says with at-home tests not getting reported to the CDC, they don't have a fully accurate number, but the data they have is showing a spike in cases in the state since the beginning of the holiday season.
Yes. We talk about hospitalizations and deaths, but those are really what we call late indicators, right? Folks so ill that they have to go to urgent care, they have to go to an emergency room. But they're late. It's good to assume if you're seeing a rise in hospitalizations and deaths, that the activity is much higher. And you're right, we can't capture every at-home COVID test, but I'm glad people are using them. But based on what we're seeing in US CDC's data, wastewater surveillance, it's good to make that assumption that there's just high COVID activity all around.
Dr. Va adds prevention is key. If you have symptoms, test. If you don't have symptoms, wash your hands, distance when possible, and get your updated COVID vaccine, something that Dr. Va says isn't happening in Maine.
Unfortunately, our COVID-19 vaccine rates specific to the 2023-2024 vaccines, it's really low, both nationally and here. We've seen a significant drop in uptake.
While it's too early to tell just how often we will see COVID spikes, cyclically, seasonally, or annually, Dr. Voss says COVID is here to stay for now. In Augusta, I'm Corey Bouchard for ABC7 and Fox 22 News.